I chose Henry Ford because your fellowship is a really important year. You can never get it back. So Henry Ford really offered the training and the experiences that you can't get many other places.
I chose Henry Ford to come for my fellowship mainly because I heard about the great reputation that it has. I'm from out of state. I'm from Pittsburgh, so it's farther from my family than other places I had been looking, but I knew of the reputation and I knew about all the different areas that I could get experience in, and that was really important.
The benefits of a Henry Ford Fellowship are that you get a huge variety of different experiences. Personally, for myself, I came out of graduate school and I had a hard time deciding what I really wanted to focus on. I had a broad range of interests. I liked pediatrics and I also liked acute care with adults. And Henry Ford was the only fellowship that offered me training in both pediatrics and adult acute care. So I'm actually a split fellow, so I do half of my time in outpatient pediatrics and half of my time in inpatient acute care.
Fortunately, speech pathologists graduating with their masters have many opportunities as far as locations for jobs and experiences early on in their career. However, your 9-month fellowship is something that you need to put a lot of thought and effort into, and choosing Henry Ford was something that was an easy decision for me to make due to the leadership skills that were offered here, the opportunities with pediatrics and adults, and the supervisor roles as far as offering continued education and support.
We get to see a whole variety of things. One minute we might be seeing a trach patient. The next we might be doing a dynamic swallow study. We might be doing a FEES the next minute, going to see an awake craniotomy. Or we might go and see an outpatient.
There are just so many skills that I'm able to get here at Henry Ford that I knew I wouldn't be able to get at most fellowships, because most fellowships might be, only outpatient or only inpatient or something. And here, I really feel like the clinicians make it a priority for the fellows to get that experience and to help them grow as clinicians. And everyone has been so nice and very knowledgeable and encouraging with those skills.
We see a huge range of patients. We do dynamic swallow studies with the radiology division, and then we do a lot of patients who have pulmonary issues, patients who have trachs. We do voice restoration with Passy-Muir valves. We do fiber optic endoscopic evaluations of swallowing as well. So a broad range of patients inpatient as well, both for speech, language, and swallowing.
Although I was hired as a pediatric clinician, I've had the opportunity to learn the inpatient role in working with adults and completing dynamic swallow studies with fluoroscopy and the radiologist, which was a great experience that I think is going to continue to benefit my skills and marketability later on in my career.
We have a really great variety of patients here at Henry Ford. We get the inner city patients, the ones from the suburbs. They come from all over the state because it's such a well-known hospital. So we get a great variety. And it's really well respected, and this I feel in the speech pathology world. So it's a really great place to work.
All of the clinicians, I would say, have acted like leaders for me. I know that a few of them are working on research. They're going to get their PhDs. They're really modeling that professionalism and that the higher expectation of excellence. And not only that, but just at a clinical level, they're so highly involved and they really take the time to do a thorough, chart review, and they know all of the medical things that are going on with the patient. It's not just isolated to what we're looking at. It's not just isolated to what's going on with your swallowing or what's going on with your speech.
The faculty and leadership is just phenomenal. I couldn't have asked for a better team to work with. When you first start, they want to know what your interests are so they can specifically tailor your learning to what you really want to learn. And they're really good with how they supervise you. They start off giving you a lot of support, and every day, every session, ask you, so how are we doing? Let's reevaluate. How independent do you want to be? What skills do you need to work on? And so it's just a constant, ever-changing process until you're fully independent. And I've never had a team that was so open to having me ask questions all the time. You never feel like you're asking a stupid question because this fellowship is here for you to learn, and they're great about that.